Hey, my friend, great to be back with you today. Dr. Lee Warren here for some more self-brain surgery. I'm glad to have you listening. I'm grateful for your time, and I hope that you get a lot out of this today because I have a special guest for us today. My friend, Dr. Jeffrey Schwartz, is one of the preeminent, and I say that without any hyperbole, one of the preeminent psychiatrists of all time, one of the leading voices in the world, especially as it comes to obsessive-compulsive disorder and understanding the difference between the mind and the brain. As Schwartz wrote in his amazing book called You Are Not Your Brain, if you don't understand that you have control over what your brain is doing, then you are really powerless. You're essentially cutting yourself out of the dynamic of power that you have in your life. If you have some background, as I'm going to tell you a lot about in my upcoming book, The Life-Changing Art of Self-Brain Surgery, but the background is that neuroscience, really for the last 100 years especially, but essentially all of organized science since the time of Isaac Newton in the 1600s, have taught a philosophy that we've talked about a lot on this show called materialism, which basically says that you're the sum total of the parts from which you are made, and that everything about you has to do with the function of those parts. And since 1953, when we understood how genetics work more clearly, since Watson and Crick gave us the structure of DNA, then essentially the prevailing dogma has been that your life is really determined by the genes that you inherit, the family you're raised in, the circumstances that you go through, and the challenges, traumas, tragedies, et cetera, that happen to you because your brain is sort of fixed. You can't really rise above your making. The parts that you're made from determine who you are. But the truth is that has been coming unraveled. All of science in the last 50 years especially, cosmology, molecular biology, evolutionary biology, genetics, cell biology, and especially neuroscience, have undergone some radical transformation in the honest interpretation of the data that we're seeing, especially in neuroscience. Like I said, since the early 2000s with functional brain imaging, it's been made very clear that the mind has controlling influence over the brain. Now, even if you are an atheist and agnostic, you don't believe that there's really a mind out there, a spiritual side of anything, or that you don't believe that mind and brain are different, you have to admit that quantum physics and modern neuroscience, as we've talked about on this show many times, definitely show that the way that you think affects the way that your brain functions and is formed, which really literally means that your mind creates your brain. So you're not stuck with the brain that you have. Well, the basis of all of that work comes down really to Jeffrey Schwartz and a bunch of other people like him that were studying this. And Jeffrey chose to go into psychiatry and specifically to study obsessive-compulsive disorder because he thought that disorder gave us the most clear insight into how you could make your life better by understanding that not everything that you think about is true and not everything you feel is real. And so Schwartz is where I got a lot of the basic science understanding of the things that I teach you on this show all the time. So Jeffrey is a clinical psychiatrist and research professor in cognitive neuroscience, psychiatry, neurobiology, functional brain imaging, and he is way off the charts intelligent, okay? Now, I'm a brain surgeon, and Lisa and I, over the course of our career working together, have dealt with a lot of people, smart people, like electrical engineers, the kind of people who build new MRI technologies, okay? People who invent things like that, mechanical engineers, electrical engineers, physicists, quantum physicists, neurosurgeons, neurologists, all these kinds of people we've interacted with a lot. And I sometimes feel like the dumb guy in the room when I'm talking to some of these people who work in these areas that are so esoteric and so difficult to understand, that me as a kind of a practical surgeon guy, the guy that puts my hands on things and works in the substrate of brain tissue, is sometimes I'm struggling a little bit to keep up. And Lisa and I have joked a lot about how sometimes it's not the brain surgeon, it's not her, the entrepreneur, the interior designer, it's not us that are the smart kids in the room anymore. We kind of sit in the back of the room and listen to some of these conversations. Well, Schwartz is at the top of that type of intelligence. So he and I have a conversation that might be a little hard to follow in some places. So I want you to just pay attention to the way I kind of direct the conversation that we're having. And I want you to understand that what Jeffrey's really getting at is that for the last 50 years, he has pursued in his own life a path that led him from understanding that he had the ability to change what he thought about. And when things were hard, he could choose to look at them from a different perspective, and that would change the outcome of what was happening in his brain, body, mind, and life. And so Jeffrey has an interesting history, as he's going to tell us. He grew up as a Jewish kid from New York, certainly not an atheist. And then he followed his passion for mind-brain understanding into a long practice of mindfulness, which he pursued in the past in a traditional sense of Buddhist meditation. Now, Buddhism is not Jeffrey's religion and never has been, but he picked up the understanding of what mindfulness really is. And that's very different from what we hear now on Instagram and in pop psychology. When people talk about being mindful, they're usually talking about just trying to get into the present moment and really pay attention to what's happening. And Jeffrey's going to make that very clear. Let me play a clip from the talk right now to kind of give you a taste of what's to come, but especially to make sure that when we get into that portion of the conversation about mindfulness, that you really understand what we're talking about here. I'll come back in just a second and tell you why that matters.
Here's problem with the pop mindfulness movement. They make it sound like, quote unquote, being in the present moment is mindfulness. False. That's false.
Right.
Now, it's not a radically false statement, but it's radically incomplete, because being in the present moment is a necessary but not sufficient condition. If you're mindful, you're in the present moment. But if you're in the present moment and just in the present moment, you're not necessarily being mindful. And metacognition is the missing ingredient, because the difference between pop mindfulness is the solution to the problem of why being in the present moment is not necessarily mindfulness is because in the present moment, in real mindfulness, you need to be making, I like to use the words, assessments and discernments, and then that became this concept of the wise advocate.
Okay, so I really want you to understand that when Jeffrey talks about mindfulness, he's talking about what you and I have talked about a lot before, about the difference between Eastern meditation and pop psychology and Christian meditation, for example, is that you're not trying to just separate the left and the right halves of your brain. You're not just trying to get out of that laser-focused two-dimensional left side and into that more nuanced, big picture, sort of connected to the universe and to God and everything else, right hemisphere. But in Eastern meditation, you're also trying to just calm all the voices down and not hear anything, just get into your own self and connect with the universe, they say. But Christian meditation is a very different thing. And when Jeffrey talks about mindfulness, he's using a phrase that we would call, or I would call, meditation on the Christian side, which really is the other half of prayer. And we've talked about it a lot before. And again, if you're not religious, just understand that the neuroscience of this has been very well worked out. And Jeffrey Schwartz and Andrew Newberg and a lot of people like that have done some great research to show that there is a tremendous positive benefit to your brain structurally and to your life emotionally and your resilience and your ability to deal with hard things, to getting into these mindfulness practices and getting your mind to control your brain and not the other way around. So even if you're not religious or spiritual, please take this conversation seriously, because it'll make a difference in your life. As I'm always telling you, you can't change your life until you change your mind. And the way you do that is to understand that mind controls brain and not the other way around. Well, Jeffrey Schwartz is really the reason that I came to understand this. His book, first, Brain Lock, was his book about obsessive-compulsive disorder, and the program he worked out, the 4-step program he's going to talk about in a minute, to help those people, often with tremendous success, even when they weren't taking medications or an augmentation to their medication. His treatment program for obsessive-compulsive disorder is tremendous, based on cognitive behavioral therapy and understanding the difference between mind and brain. He made a difference for hundreds of thousands of patients. Well, his next book was a more academic look at the difference between the mind and the brain. Guess what it's called? The Mind and the Brain. This is one of my all-time favorite books. It made a tremendous impact on me as a neurosurgeon, as an understanding of how to separate these problems that I was having of getting my brain under my own control, especially after we lost our son. Schwartz's book has been one of the most instrumental drivers of my thought processes and really led directly to me writing about self-brain surgery, especially in the new book. And so I give Dr. Schwartz a lot of credit, and I'm grateful for his friendship and his time that he spends with us today. I got to know him through a third party, David Carrion, a psychiatrist that we had on the show last year. He wrote a tremendous book called The Opposite of Depression, which I really highly recommend that you read. The opposite of depression, it turns out, is not happiness, because you can feel happier and still be stuck and still be depressed. The opposite of depression is flourishing, is getting your life back on track. And Schwartz taught Carrion that. He was one of his professors. And when I saw in David Carrion's book when he sent it to me. That Schwartz was one of his mentors at UCLA. I thought I'd reach out to Carrion and see if he could facilitate an introduction to Dr. Schwartz. He did it. Jeffrey and I have become really good friends. And we have a conversation today that's really about understanding the difference between mind and brain over the course of a long career that led Dr. Schwartz from Judaism to embracing the mindfulness practices of Buddhism to ultimately converting himself from neuroscience to Christianity. He got baptized after he understood this. It's a fascinating story. We have a good time. It goes all over the place. Jeffrey's kind of hard to pin down. He's so smart. He's always a step ahead. So pay attention, dig in deep, make some notes, and learn today from one of the preeminent psychiatrists in the world that you are not just your brain, my friend. You're a lot more than that. Before we get into this conversation, I have a question for you. Hey, are you ready to change your life? If the answer is yes, there's only one rule. You have to change your mind first. And my friend, there's a place where the neuroscience of how your mind works smashes together with faith and everything starts to make sense. So I'll ask you again, are you ready to change your life? Well, this is the place. It's Self-Brain Surgery School. This is where you learn the truth about how science and faith are designed to work together to answer the big questions that trauma, tragedy, and other massive things bring us. Here is where you learn to manage your mind, optimize your brain, and navigate your life to become healthier, feel better, and be happier. This is the Dr. Lee Warren Podcast, where we go deep into how we're wired, take control of our thinking, and find real hope. This is where we leave the past behind and transform our minds. This is where we start today. Are you ready? This is your podcast. This is your place. These are your people. And now is your time, my friend. Let's get at it. Friend, we're back. I'm so excited today to be introducing you to a person I consider a mentor. I've learned so much from him. A friend, UCLA psychiatrist, Jeffrey Schwartz is with us today. Welcome to the show, Jeff.
Hi, Lee. Nice to see you.
It's good to see you. We got people all over the world that'll be listening to this today in about 150 countries, and many of them will have read your books, and they've heard me talk about you a lot. But just give us maybe just a brief overview of your life and your career, and then we'll get into some questions.
Okay, I mean, look, the thing that I've been interested in for, like really a long time, I mean, because I've been at UCLA, I mean, this is going to be my 40th, year at UCLA here. This is my 40th. And really that whole time, which in, neuroscience terms is like a long time. I mean, that's a significant percentage of the history of the field of neuroscience, or at least the modern history of it. And I've always been interested in what at the time and now is still a marginal subject. It's just never, I mean, so I have to I'm being really candid right up front that there's the notion of looking at mind-brain interaction in neuroscience was and always has been, at least in modern neuroscience. In older neuroscience, it wasn't as marginal, to be honest. This has a lot to do with what's happening with the culture of science, to tell you the truth, and even the culture of academia, which was and has stayed, and maybe is slightly less physicalist, or, that is kind of the philosophical term, or materialist. I've been interested in, how the mind can change the brain in a physicalist era.
Yeah.
And that's why my book is like, You Are Not Your Brain, which is a heretical statement. I mean, it is a heretical statement to those people. I mean, neuroscience has become something like a religion, and it's a physicalist religion. And there's a church. I've known a lot of the high priests in it. To say, some of them I don't even want to mention their name because I'm so have such unfond memories of some of the most Nobel laureate neuroscientists. But I wanted to use brain imaging at the very beginning of brain imaging, basically, functional brain imaging, to show that willful decision-making can have effects on how the brain works. And that's what, the mind can change the brain means. It means what you decide to focus on has real world effects on how your brain works. And pretty early on in that, very early on in that 40 years ago, I mean, so it's about, we started studying, we did definitely work on depression, but the real work where I tried to make, this kind of philosophical point, and then I wrote some self-help books about it. I wrote a book, called Brain Lock, which is
Yeah.
still to this day a leading book for self-help for people with obsessive-compulsive disorder. So the majority of my most well-known work was done on obsessive-compulsive disorder. And then we developed, I developed, kind of a technique, a self-help kind of, but definitely be therapist-assisted technique that integrated another thing I've been really, really interested in for even more than that, for now 50 years. So my first formal training in mindful awareness was 50 years ago this summer. I mean, exactly 50 years ago it's going to be. And
Wow.
so it's kind of a mindfulness based, and one term that's become more accepted is quote unquote MBCT, which stands for mindfulness based cognitive therapy, and that was coined by a colleague of mine in Britain named John Teasdale. So what I do, which is called the 4 steps, which I'm sure we'll get a chance to review because you like it, is a form of what you could call mindfulness based cognitive therapy, but I particularly put a accent which John Teasdale doesn't, because he's not that much of a neuroscientist. He's really just more of a psychologist on how it changes the brain. So that's it in a nutshell. How you can use mindfulness, and then just I guess because I know it's relevant to you and your audience. I was always philosophically oriented. I mean, I got my undergraduate. I have an honors degree in philosophy from the University of Rochester. And so I've always been interested in philosophy and trained in it. But then in the early this century, I'd always been kind of, sort of interested in Christianity. And in that way, I was influenced by T.S. Eliot, among others, because I also was very interested in poetry. And T.S. Eliot, his long poem, 4 Quartets, really influenced me a lot. Which I think most people would say is, the great, Christian poem of the 20th century. And then early in this century, I actually went and I also, so to contextualize that, I definitely grew up, an observant Jewish boy. I mean, I had an Orthodox Jewish, bar mitzvah. And I'm definitely have always been nothing. I won't say nothing except because the Christianity part got added on, but another big part of my sort of worldview that's not as related to mind brain stuff in and of itself, though, but it definitely a critical part of my broader worldview that you're interested in. I mean, you're the only other person I know who knows anything about the brain who's interested in this aspect at all. That's why this is all very kind of unusual. Which is why I kind of decline a lot of podcast requests, because I'm going like, who am I going to deal with what I really think about? But with you, it's kind of much easier. So I was baptized in 2008, but in no way has that diminished my sense of Jewish identity. So it's the religious indicator, Jewish Christian, which of course is, having a strong New Testament scriptural contextualization, it means a lot to me. I mean, I am, so I am a Jewish Christian person who is very interested in the scientific, philosophical, notion of, volitional effects of the mind on the brain.
Well, that's a very succinct description of really a seismic movement in your life. From when we talk about materialism, physicalism, the listener to this show will have heard me talk about that a lot, where the idea in neuroscience, and I was raised in that camp too, as a brain surgeon, right? The whole idea was the brain's fixed, can't really change once you're an adult. The mind is generated by the brain, like everything about you. You think even the fact that you have a self is the activity of neurons in your brain. And when you die, your brain dies, and that's it. And that's the story.
Now
I was raised in that world.
I don't know how often, so again, the audience know, because it turns out that the history of the field of neurosurgery is more friendly to what I do than the field of psychiatry is, which is counterintuitive in a significant way. But a meaningful amount of that, and I don't know how much you've spoken about him, and I'm not trying to change the subject, but a name that has to be mentioned because I could have, another book that I was really influenced by, even before I became a scientist, right? I mean, when I was still, is The Mystery of the Mind by Wilder Penfield.
Wilder Penfield,
So Penfield was assertively, okay.
It's on my desk.
Penfield was assertively non-physicalist. And because he was a neurosurgeon and an epilepsy neurosurgeon at that, there wasn't a whole lot they could do to undermine his credentials.
That's right. Well, it's interesting because, he didn't start out that way, though. He got there by doing awake brain surgery, and he kept stimulating the brain. And he could make somebody remember something. He could make somebody move something. He could make somebody feel something, but he could never make anybody think something. Like he could never generate philosophy or poetry or Shakespeare. And when they had seizures, he said, we have all kinds of seizures. We have movement seizures and feeling seizures and olfactory seizures. We don't have, chess seizures where you get the whole picture of a game in your head, or you don't have abstract thought in seizures. And so that's actually, he converted himself to dualism by doing brain surgery.
Yeah, exactly. It's a great story. And he was also a very good writer.
Yeah.
So yeah, he's a really important person. I don't know how much neurosurgeons even talk about him anymore, to tell you the truth, but you would know that. But he's a standout figure. He'll have his day even more. I mean, I think he'll be more famous 100 years from now than he is right now.
I think you're right. Everybody catches up to him and you and guys like Henry Stapp, who we'll talk about in a minute.
And then Stapp, Stapp. Stapp is very important on the physics side, no question about it. Exactly.
I want to say, or ask rather, so you kind of glossed over it a little bit, but you were never an atheist, right? You were kind of
never.
You were never an atheist.
I never was even almost an atheist. I have had no meaningful interface I always knew that atheism from where I stood was bad mistake. From as little, never is the right word.
Yeah, I can wrap my head around agnosticism as an honest pursuit of trying to figure out what you know or don't know. It's hard to wrap my head around atheism, to be able to say I absolutely know there is no God.
It's like I just said about neuroscience. In a way, atheism is a religious fundamentalism. I mean, they would deny that up, down, left, right. I mean, but there's nothing, and if you look at the history of science, there's nothing intrinsically atheistic whatsoever in the history of science. I mean, right. I mean, even like Galileo, he was no atheist. He wasn't even almost an atheist.
All the great scientists. Yeah.
And Newton, now Newton was an anti-Trinitarian, but that's a whole other question.
That's a whole different podcast.
He was extremely serious anti-Trinitarian, but that's a whole other question. That's a subset. I mean, but yeah. So yeah, this has been a 20th century now into the 21st century. But it's fading a little bit, I think, in this century. But it dominated the especially the second half of the 20th century. Yeah, it's a problem. Atheism is a religious fundamentalism, and it has nothing to do with science.
Yeah, I just had Stephen Meyer on the show, who and he talked about how since the cosmologists figured out that there had to be a beginning with the Big Bang. And the time frame is shorter than the Darwinists thought they needed to have for all this stuff to have been able to randomly evolve. Like, it's gotten harder to defend that position scientifically than it was, say, 50 years ago, 70 years ago when Watson and Crick came up with DNA. It's much harder now to be an honest scientist who says that they don't believe than it was 50 years ago.
Well, I mean, I'm not saying you have to be dishonest, but you have to be ignorant. And that's kind of the problem of this culture of science. Ignorance at that level, it's highly accepting of.
Wow.
It is.
Jeffrey Schwartz.
Philosophical ignorance at the level of being a staunch physicalist who says this is what science says is an ignorance that is mainstream. So there you have it.
I watched a whole video yesterday, and this is interesting because it'll get us into this idea of what you said a little bit earlier, is how you perceive the world kind of turns into what is real for you in the world. And we know
Yes.
now how the mind reacts to, or how the mind directs structural changes in the brain based on what we tell it to think about and care about. But I watched a whole video of a guy who was saying that religion and religiosity is generated by brain activity, and that certain people have more of parts of the brain that generate those things. And it was just so clear that everything he saw in reviewing research from people like Newberg and you, everything he saw was being interpreted through this lens of it's all coming from the brain. So we have to explain everything we see by brain activity. And there was just
They
it
don't
was just
see
a
that, which is
circular.
why I'm using the word ignorance. I'm not calling that guy dishonest, but he's not, philosophically, it's like it's not. I mean, look, physicalism is very influential in philosophy as well, but at least they, make arguments to, try to make their case. I mean, this guy's not making arguments to try to make his case. He's assuming his case is true, and then that there's no alternative case, and that's the truth. I mean, and that's ignorance.
But it has to do with this idea of perception filtering into what turns into is real for you. And if you can't get into that metacognitive state where you can say, hey, maybe my perceptions are creating, I need to broaden my perception a little bit, right?
Metacognitive is a great word, and metacognitive has a real relationship to the word properly understood. There's another word that's become debased. It's painful for me to say that. In fact, mindfulness as sort of a, it's kind of sort of peaked and is, pop mindfulness is problematic. But I mean, real mindfulness. And what's the difference? I mean, it's easy to say what the difference is. And this is an important educational point. I mean, because when I say real mindfulness, I mean mindfulness based on, there's a Sanskrit dialect, not very different from Sanskrit, called Pali, which classical, old school, pre-Christian Buddhist scripture is written in. And, so that's what I call real mindfulness based in the school of Buddhism. I mean, whatever, we're not here to talk about Buddhism, but I have a very serious long-term meditation practice that's gone, 50 years. I mean, and a significant part of that was 30 years of that was done like strictly within the old school real Buddhism. Real Buddhism has real mindfulness. Yeah. And so I want to make really clear that I'm not like just in any way sort of being arbitrary about what I designate, what I call real mindfulness. It's scripturally based, classical Theravada Buddhist mindfulness, pre-Christian mindfulness.
Right.
Okay. And it's very related to this word metacognition. But okay, here's problem with the pop mindfulness movement. They make it sound like, quote unquote, being in the present moment is mindfulness. False. That's false.
Right.
Now, it's not a radically false statement, but it's radically incomplete, because being in the present moment is a necessary but not sufficient condition. If you're mindful, you're in the present moment. But if you're in the present moment and just in the present moment, you're not necessarily being mindful. And metacognition is the missing ingredient, because the difference between pop mindfulness, I mean, is the solution to the problem of why being in the present moment is not necessarily mindfulness is because in the present moment, in real mindfulness, you need to be making, I like to use the words assessments and discernments, and then that became this concept of the wise advocate that is the featured part in the book You Are Not Your Brain, which I recently re-recorded. Yeah. So now the audio version of that is something I just recorded in the last few months. So that's brand new. This concept of the wise advocate that makes assessments and discernments about what is sort of perceived in consciousness in the present moment. But assessment and discernment are very good proxy terms for describing what the word metacognition means. I mean, it's kind of cognition about cognition.
Right. Thinking about your thinking. Yeah.
Yeah. It's thinking about what you're thinking, or having, cognition making discernments, and that's another really important word. Assessments, discernments.
Right.
Having discernments about what you're thinking. That's what makes it mindfulness. And the term in classical Buddhism, which is a key term in all of Buddhism, and is one of the most important terms for understanding what, Gautama, who Buddhists call the Buddha, taught, is a term, I'll just say it in Pali just to get it there. It's Yoniso Manasikara. And Yoniso is reasonably translated in that context as wise. Manasikara is extremely common, very, very, very common word in Pali, in the Pali text, means attention. So wise attention is what mindfulness is all about. But the wisdom aspect of it is critical. And when you make being in the present moment the cardinal, where's the wisdom? Then there's no particular wisdom simply in being in the present moment. I mean, you can be in the present moment for all kinds of things. And some of them have very unwise perspectives too, so that's it. So that's an important distinction right there.
I think it's important for the listener, especially who is Christian, because Christians hear things like meditation, mindfulness, and some of the Christian traditions would say, no, you just need to pray. And don't think about that. But I think it's important to parse out the difference between meditation, as it's, like you said, popularly used
Christian
today,
meditation or Christian mindfulness. Look,
right. So
again,
what's the difference
even
between?
The statement, I'm not going to criticize the statement. You need to pray at the level I'm going to criticize. Be in the present moment. But it is no really serious Christian. It's just not New Testament theology. It's not scriptural New Testament theology to say that the term you need to pray in and of itself isolated is sufficient to describe Christianity. It's not. I mean, you need to pray, but you need to pray in a certain kind of a way, with a certain kind of awareness and a certain kind of knowledge about, what are the more appropriate things to pray for, as opposed to things that are inappropriate to pray for.
Yeah.
Etc.
Right. I think this idea
there are definitely things that are inappropriate to pray for, unless, and they're not that simple to delineate. I mean, anyone who reads the Psalms knows you can pray for the demise of your enemies, but how you do it is really important.
That's right. I think, part of our conversation today, obviously biographical. We've talked about your story a little bit and glossed over some years of it. Part of it's going to be therapeutic, because I want to get to some practical things that the listener can take away from their lives based on your experience and your career. But there's a bridge in there that I want to cross with you, Jeff, of what was it in your life? So you're coming up trained as a neuroscientist in an environment, like even a little bit before my time, where it was really hardcore materialist, physicalist training. But at some point you noodled out that there's a difference between the mind and the brain. In fact, your book, The Mind and the Brain, was the first one I read of you. And that really had a lot to do with my thinking of clarifying my thoughts that led to my new book that you were so kind to endorse. So where was it along your journey as a psychiatrist where you started saying to yourself, hey, the mind and the brain are not the same thing?
Okay, but I mean, even in what I've already said, I mean, some of your listeners should be able to type in and say, oh, Lee, he answered that already. No, I'm just fooling around. But it is going to be, I'm only contextualizing it that way because what I'm about to say is kind of repetitive. I mean, I was, you got to remember, I mean, I was an Orthodox Jewish boy who was extremely faith-based, who also had, kind of a full, 5 to 10 years at that point, classical Buddhist mindfulness, because it's 50 years ago that I started formal, serious training in this meditation technique. I was doing even that as an Orthodox Jewish person. That's the other thing. I've never really called myself Buddhist as a religious identification. As much as I've been involved and engaged and studied it, I never called myself Buddhist as a religious identifier, ever. And I was careful not to do that because I was an Orthodox Jew. I was Jewish, and then I became in the early 8, I was baptized, and then I was Jewish Christian, but I've never been quote unquote Buddhist in that
Right.
way, as serious as I've been about it. So yeah, when I started doing neuroscience, and then I met since Crick's, some of this wasn't worked out, but I really realized, what I was up against, really clearly, because I became a postdoctoral fellow in like 79, 80, and then for several years, for 2 years. I was a postdoctoral fellow, even before I did a psychiatry residency, honestly. I did 1 year of psychiatry residency, whatever. But I was at the Salk Institute in La Jolla, California, back in the days when Jonas Salk was, walking around. There. And one of the people there was Francis Crick, and he actually spent a lot of the time in the lab next door to mine, and I really got to know him. And then he sort of came to our lab meetings, and he saw the way I was thinking, and he wanted to have lunch, and we used to have like lunch a couple of times and get into these whole discussions, because one of the reasons he wanted to talk to me, a postdoctoral fellow, was because, I reminded him of what his brother said that he completely disagreed with, and he wanted to show me how wrong I was. So here I was, debating. He was a very civil guy, and whatever I'm going to say about Francis Crick, who I knew pretty well. He did he have a perspective that he was very assertive about? Was he a reductive physicalist? No, he was an assertive reductive physicalist. But he listened. He listened. He was not ignorant. He listened, and then he tried to debate. And I kind of realized, how much, he has had extremely, because of how influential he was. He really made the physicalism in neuroscience even more establishment than it already was. So it got it was, I would say in 25 years, in the late 20th century, and then the early up to now, the physicalism really became, kind of a religious part of neuroscience. Like every neuroscientist has to believe this. It wasn't really like that, that much in that way before. So yeah. So that, it's those kinds of things that, I came in, I went into brain imaging. I went into the field of brain imaging because it was a new field that seemed very, open to being used to show that, choices, decisions, volitional effort can change the brain.
That's right.
And I used it in that way.
Well, so you never drank the Kool-Aid, and I didn't either. I think surgeons are more. We work in the material part of it. I'm putting my hands on somebody's brain, and I'm going to cut out their temporal lobes so they stop having seizures and stuff.
Right.
But I was raised as a Christian, and I never believed that when I died, I died. I always believed that there was some part of humans that persisted. We call it the soul, right? That is the mind. But I had to work in that environment, and for me, it was. I told the story in the book that you read. It was watching functional MRI scans of people being told to think something and that resulting in changes in their brain and then their body's physiology. That for me, that was like this moment where I said, okay, now I can completely articulate that mind and brain are separate things. And then I started
many
reading.
people doing functional brain imaging had that experience, which is sad. And mostly what they ended up doing is saying, don't go there. I could tell you again about, and still very eminent people, who there are people who will remain nameless in this because, why go there? One of the most famous neuroscientists, arguably the most famous neuroscientist of the 20th century, really tried to end my career.
Wow.
And to having a Nobel laureate, he hadn't won the Nobel Prize yet, but he won it shortly thereafter. Trying to shut you down. That's not fun.
No.
And then another person so before I went to the Salk Institute, I was at Stanford when I was still a medical student. And I did a rotate. I kind of went from New York to I went to medical school in Brooklyn, New York. But then I did a full year at kind of Stanford and Berkeley. And somebody who's now extremely eminent, very senior medical executive, head of a very, very well-known medical center, who took me in his office, and he was a young assistant professor then. And I was a medical student. He said, Jeff, you got to let go of this mind-brain stuff. It's not where things are going. It's going to hurt your career.
Wow.
Don't do that. I'm going, hey, I almost said his first name. I said, it's what I believe. It's like why I'm here. He goes, and then he also said, like this Freud stuff. Freud is his own thing. We don't have to talk about Freud. But I was really influenced also by reading Freud, because I started reading Freud as an adolescent. And I had read a fair amount of Freud already, even by the time and then in college. So by the time I went to medical school, I had read, a significant amount, not about Freud, of Freud. And that, and Freud has his problems, and we're not even here. We don't even kind of have to talk about that much anymore. But he that's what I mean about comparing Freud and Penfield. Freud was some version of a materialist, which is strange given what he said. But that it shows you how much grasping this whole brain thing is, that even Freud thought all this, whatever. It's a whole strange thing. But Freud was rapidly going out of fashion. Freud was from the 50s. This was then into the 60s. And then with the beginning of the psychopharmacology age, it faded and faded. There aren't that many MD Freudians who even exist anymore. Most people who are quote unquote Freudian are PhDs or whatever, or marriage and family counselors or whatever. So it was I had all this kind of background that I was able to integrate, but he was saying, Freud, I wasn't as emotionally engaged with Freud as I was with, this whole issue of the mind can change the brain. Because even I knew Freud wasn't a big fan of even that way of thinking. I knew by then, even though he didn't so it's whatever. The history of psychiatry is not it's got its problems,
Yeah.
There's no figure like Penfield. Whatever. I don't know that much about, the deep. At least one thing for neurosurgery, and it's not just him, but he, there is a giant who really had a strong perspective in the field of neurosurgery, and it's Penfield.
Now, definitely Penfield is the guy who first sort of unlocked the mind-brain disconnection, and then nobody would touch it. Like he wrote Mystery of the Mind and talked about it, changed his perspective from physicalism to dualism.
Yeah, but that was the result. He had written. That book was not that book was a pretty late in his life summary of what he had been thinking
kind of
for
philosophical.
He wrote that for lay audiences. So he had been writing this. In more technical papers and that way of thinking, because you described the key finding. He was finding that, because he's been doing this electrically, because they're mapping out. Obviously, I'm sure you probably explained in other podcasts or whatever. The reason why he would, by sticking the electrode, because he wanted to map out the area that he had to be more careful about. In terms of making a surgical, excision, a removal. So he was trying to map it out, and he was seeing that there were certain things that just never came up that had to do with, like you're saying, abstract thought and value judgments, that you couldn't change people's value judgments or even find their value judgments with an electrode. Now people could say, well, it's other areas and that, whatever. So that it's not completely definitive, because obviously he was working in a relatively discrete but very important area of the brain, which was verbal, but it was the verbal related area, which is important, but, whatever. Obviously there's frontal cortex, there's parietal cortex, whatever, but still, Penfield's Mystery of the Mind is his, for the regular person, educated lay reader, summary of his life's work.
And I would say that book and Your Mind and the Brain are two books that if the listener wants to go a little deeper into the science piece of this, those two books would be really great places to start.
In the science, yes, exactly.
Yeah,
I would say Mystery of the Mind has got a fair amount of what's in You Are Not Your Brain, because You Are Not Your Brain is kind of a simpler, the simpler, more because the Mind and the Brain is not a self-help book.
No, it's not.
It's really a science. It's a science book.
That's right.
It's kind of an, educated lay reader science book. And then you are not, your brain, kind of was taking what was in the mind and the brain and making it like more user friendly and more applicable.
That's right. Mind and the brain is more of a kind of, let's tell you what the science revealed and how we got to this place. And then let's pivot now and let's have that clinical conversation.
Yeah, the few minutes sound like what's the 4 steps and where's the mindfulness and
Yeah,
so on.
I mean, there's nobody alive that has done more, I don't think, for obsessive compulsive disorder at least, than you have. Talk to us a little bit about
I can
the
find
way
you
you
people who
developed
disagree with that statement, but that's not. Don't worry about it. Given everything I said, I'm sure you won't be shocked to hear that. I am not, again. I am not in any. I mean, it's whatever. I mean, it's just where you. That's it. Let's deal with Let's not. I'm not making a fantasy version of the reality at the age of. I'm going on 74 here in a couple of weeks here. So. But yes, the 4 steps are very helpful. It's definitely true that Brain Lock still is a book that sells well, and your brain also sells well, not quite as well. But Brain Lock, and then the book you like, The Mind and the Brain, kind of grew out of the scientific basis of
Right.
that. I mean, but it's 4 steps: relabel, reframe, refocus, revalue. And the relabel part comes right out of classical mindfulness. I mean, I took it from a classical training in how to do what's called insight meditation. Vipassana meditation is the actual word. Vipassana is readily translated as insight. And one of the great 20th century teachers of that, who was the teacher of a teacher that I had, used this putting labels on your experience to become more mindfully aware and make then assessments and discernments or use wise attention. So just to put it in, without bringing my language into it, because assessment and discernment, wise advocate, those are like terms that like are from my perspective. From his classical perspective, and I might as well at least mention his student's name, who was my teacher, 4 Foundations of Mindfulness by Venerable Silananda. Silananda, still readily available. It's the translation and commentary that he did on the classic text of ancient Buddhism on mindfulness. So his teacher used to use making mental notes. They used to call it making mental notes. And so when you have an experience, you make a mental note. It obviously can also include very much emotional terms. Happy, sad. Attracted, repulsed. I mean, and then, but even hot, cold, walking, and then making mental notes about using a word to help you describe and become aware, mindfully aware. Use wise attention to make. I'll use the word discernment, because that is to make discernments about the nature of what you're perceiving. So that is the training in insight meditation that I had. It's classical Vipassana meditation training. And then I brought that directly into this step 1, relabel. So, I mean, and if we're doing it with obsessive compulsive disorder, it makes it very straight ahead. I mean, then we broadened it out, and then you are not your brain, we really broaden it out. It's not particularly about obsessive compulsive disorder anymore in that book. I mean, but in obsessive compulsive disorder, if you're getting an intrusive thought like wash it, it's dirty, you need to like make a mental note like, I'm getting this like wash it. But then you need to, reframe that and say, wait a second, I'm getting the urge to reframe it, but it's like that is my brain sending me a false message. So that's where the cognitive element comes in and the metacognitive element comes in. The relabel is telling you this is what you're experiencing. The reframing element is using a metacognitive process of saying, is that true? I mean, do I need to wash this? Is this actually dirty? I've just washed it 3 times. Right. I mean, no, it's not dirty, but I'm still getting this bothersome feeling telling me to wash it again. Why? That's my brain sending me a false message. So that's relabel, reframe. And then refocus is critical, because obviously that's what training is really, really, really about. And usually it's most commonly classical using breath awareness. The awareness of in and out breathing. That is the most basic mindfulness exercise. The awareness of know when you're breathing in. When you're breathing in, you make a mental note, breathing in. When you're breathing out, you make a mental note, breathing out. That is right, classical. Gautama said that, right? That's the actual training in, a close paraphrase of what the words actually say. And what
Right.
the words actually do say is when breathing in, he knows breathing in. When breathing out, he knows breathing out. And then when your mind wanders, you bring it back to the breath because your mind will wander. You won't, no beginner or even, the mind wanders. You won't be able to follow your in and out breathing for very long before your mind wanders and you miss a breath. And then you just go by,
Right.
okay, missed a breath, go back to the breath. So that's, the relabel, reframe, refocus. And that's the process right there. Relabel, reframe, refocus. And then when you do that regularly, that's what we said. It changes the brain, it changes the frontal cortex, it empowers because the prefrontal cortex is critical in making choice-driven refocusing of attention actions. That's worth repeating. The prefrontal cortex is critical and gets activated in making willful choices to refocus the attention.
Yeah.
So when you do that regularly in a meditative practice, it strengthens, it enhances prefrontal cortex function. And then step 4 is you revalue. And then when you mix in assessment, discernment, wise advocate perspective on how you're relabeling, reframing, and refocusing, your values change. So you make much more rapid assessments and discernments of like, let your attention go there, don't let your attention go there. If your attention's going there, refocus your attention to something else. If your attention's not going in a wholesome, and then 2 very important words, wholesome and unwholesome, or skillful and not skillful. And you want your attention to go in the direction of wholesome, skillful actions and thoughts, and away from unhelpful, unwholesome, unskillful actions and thoughts. That's it.
You get better at getting better.
You get better at
training
getting
your
better,
phone.
and that's how
Yeah.
I call that revaluing.
So I love that, and let's make it practical for somebody. If you can do this, and you've shown it. I mean, you've shown it very clearly that this type of training can help people with severe obsessive compulsive disorder get better and manage their lives adequately, or even in a flourishing way, without
Yes.
medication sometimes. So that
Sometimes,
shows us.
but it's not without medication in principle, in no way. And this has a
Right.
synergistic, to use that word, a synergistic interaction. It empowers, it makes lower doses of medication work better. So
That's
if
right.
lower doses of medication can work better, that's good.
That's right. Just showing that the point being that the average listener isn't somebody with severe obsessive compulsive disorder.
Yeah, no, that right.
They're probably more like a guy like me, right?
Well, then
My son-
your brain isn't even about obsessive compulsive disorder anymore.
Right.
It's
So
really just about more day-to-day issues. How do you apply this in
that's
day-to-day?
right. And You Are Not Your Brain is a very important book. I just listened to your audiobook. You did a great job of re-recording it. And we're going to make sure that the listeners have an opportunity to get that book. I want to bring this home in a way to say, you're a normal person out there and you're struggling with something. Like for me, Jeff, just to be really vulnerable, my son died when he was 19. And so I frequently have these thoughts like, what kind of dad are you? Like, how could you can't get your kid to adulthood. Your kid's not going to be there to bury you someday, right? Those kinds of thoughts. And you start ruminating on those negative thoughts. And before you know it, an hour's gone by and you're on the couch and you're doing that. So
That's a great description.
So how do you, for a normal person out there who says, hey, I want to know how to get my mind operating my brain more effectively to get me out of these negative thought loops and help me be more productive and more flourish in my life, how do you talk to that person?
Okay, and that example is really a powerful example. Number 1, there's nothing, that example that you just gave has nothing really, only in the most marginal ways, to do with obsessive compulsive anything.
Right.
There's nothing obsessive compulsive in that. Okay, but this gets into the whole issue of grieving, mourning and grieving. Okay, nothing inappropriate, nothing in and of itself unhealthy about it. It's necessary, it's healthy when done in because obviously everyone knows that mourning and grieving can take over, and then it's good to have something to do about it, but it's still not obsessive compulsive in and of itself,
That's right.
because there's nothing inappropriate about the thought. It's a powerful thought that you just know that you can't just stay there, because at a certain point it becomes, to use that word, unskillful, to the point of being some variant of healthy and unwholesome to just dwell on the mourning and the grieving.
That's
So
right.
so the relabeling part goes, okay, I'm grieving now, okay, and it's obvious why, and it makes a lot of sense why, and the grieving itself is not the problem. The problem is, and this is where you're reframing, the problem is that right now I need to be doing something other than grieving, or I can't just continually be grieving right now. And that brings the refocus element in, right? I mean, so you're thinking about what you're thinking about the grieving, right? I mean, you're thinking grieving, and then you're metacognition, thinking about the thinking of grieving and saying, okay, yes, it's very upsetting, understandable, grieving is important, but right now it's not good to just get locked into a grieving process. And so I have to refocus on any wholesome, useful thing. Just do a simple thing that I need to be doing right now. And then I like to say, for 5 minutes, 1 minute. I mean, like, try to say, like, at least for a couple of minutes right now, 1 minute, 3 minutes, I'm going to just do something else, and then, like, reassess. Now, that's not going to make the thought go away. What it's going to show you is you can do something else with the thought still there. That's the key point.
That's right.
You're not trying to make the thought go away. And in OCD, that's really important, because you can't make the thought go away. What
That's
you
right.
have to show yourself is the thought doesn't have to control what you're doing. It doesn't have to paralyze you. You
That's
can
right.
do something else with the thought still there. And that
That's right.
turns out to be very, very important, to know that and to put that into practice.
That's right. And I think that I love that as a way to say, hey, anybody who's struggling with any sort of emotional or mental issue can make it better by learning how to apply these 4 steps. I call it self-brain surgery, right? You're literally changing what your brain is doing, which is going to change what your body does, right? And
With
tell
your
us
mind.
just
With your mind.
that's right. Now,
And by the way, self, I mean, since you mentioned the word soul, and this is just something I recently been doing in my Bible study. I mean, so I just actually did a whole thing on this, so it's like very current for me right now, and I know I can state this assertively because I just did the background research on it. The word soul in Greek, in New Testament Greek, is suke. That's how it's translated, and the Hebrew word for that is nephesh. So the Greek New Testament word suke is a Greek translation of the Hebrew word nephesh. Now, it by no means am I saying that soul is not a correct translation of it. It is. But it's not the only correct way of thinking about the word, because it turns out that the words self, personhood, so it turns out that the English word, I love this, the English word that's the transliteration of the word suke, psyche. The word psyche and the way the word psyche is actually used in the English language, if you think about people's psyche, that's closer to the actual meaning of the New Testament word suke and the Hebrew word nephesh
so
than
more
I
like mind.
mind, yes, or aspects of the mind. But that's the whole point. The word psyche kind of has self and mind and soul all wrapped up in it, and so does the word suke.
Right. This heart, mind, soul, all these things are kind of elements of the same thing.
Yes.
So when scripture says one of those words, it means all of them.
Yes,
The whole
exactly.
thing.
That's the whole point. It is. It is
Yeah,
the whole point. That
that's
when the
right.
word suke, which is an extremely common word in the New Testament, if you just think of it translated, put in the context of psyche, and psyche itself has enough different senses that you need to parse it apart according to the context. But that's the point. The English word soul doesn't have all those other senses. And the word soul is too limited a translation of the word soul. And life is
That's right.
another. There's multiple critical, important New Testament passages where the English word life appears, but the Greek word is suke.
That's right.
means
Jeffrey,
life. It means life as well.
that's right. I
Not, but not
promised you.
biological, not biological life. Kind
That's
of
right.
more, human, spiritual
Eternal
life.
life. Yeah. Spiritual life. Well, I promised you about an hour, and we're getting awful close to it. So I want to
Yeah, we
respect your
are at it.
time.
We're at an hour.
And I
Yeah.
hope we get to do this again someday because I think we could talk about a lot of things. But there's going to be somebody listening to this who has just gone through or is going through something really hard. They just found out they have a brain tumor. Their mom just died. They buried a child. So somebody listening is in that acute phase of trauma or grief. So maybe just in a clinical and pastoral way, talk to that person for a second. Like, what would Jeffrey Schwartz say to that person that would help them right now? What's their brain going to do to them in the coming weeks, and how can they deal with it?
Well, because you were so candid, you kind of time mark when you mentioned the death of your son, which I was not aware of that. And we just did that in this very session with you.
That's right.
Because the whole thing about mourning and grieving and what I said about, yes, I'm grieving. It's not inappropriate. There's nothing obsessive compulsive per se about it. And yet I have to use assessment and discernment, consult my wise advocate, this, which has a Holy Spirit. I mean, because the word advocate is one of the classic translations for parakletos, which is the word Jesus used to describe the
Holy
Holy
Spirit.
Spirit in John 14, 15, and 16. 14, 16, 14, 26, 15, 26, and 16, 7. Book of John. Those 4 verses, Jesus uses the word parakletos. The anglicization of it is paraclete to describe the Holy
Right.
Spirit. That's where, and helper, comforter, advocate are 3 very common translations of that. And so, yeah, consult, if you're Christian, the Holy Spirit, get the guidance, consult, your wise advocate, and then, and say, okay, I have this feeling, but don't get locked in it, and then refocus on something, useful, helpful, adaptive, even comforting, to show that, the hard feeling doesn't have to paralyze you. You can
That's right.
keep going in the face of the difficult feelings.
That's right. And your brain is designed to help you get better if you direct it properly. That's really the culmination of your work, isn't it?
Well, designed is designed is the word that makes the physicalist get really bent out of shape. I mean,
That's right.
but yeah, if you take God as the designer of the brain, it's designed that way. Let's
That's
just
right.
say God empowers you to do things with your brain. Use your brain in an adaptive way. Use your brain in an adaptive way, and the Holy Spirit the wise advocate can help you do that. And I just re-recorded, so now the audio version of the book, You Are Not Your Brain, is all about me reading in the last few months. So I just did it
That's right. And it's wonderfully done. Yeah.
about this very subject matter.
Jeffrey Schwartz, you have meant so much to me, and the work that you've done has changed the way I look at the mind and the brain and all of life, really. And I owe you a lot. I'm grateful for your friendship, and thank you for your time today, my friend.
No, that's great. I really appreciate that. That's very deeply meaningful to me. I very much appreciate that. And, thanks a lot. And absolutely, anytime. I'm good. Anytime. Just let me know.
God bless you, my friend.
Keep in touch. God bless.
What a tremendous conversation. I hope that was beneficial to you. There's 3 books that Jeffrey has written that I think you should read. The first one, Brain Lock, is all about obsessive compulsive disorder. So if you're not suffering with that, or you don't love somebody who is, you don't have to start with that one, but it is very helpful in understanding that even with a significant psychiatric disorder, your life can get better when you understand that your brain doesn't always tell you the truth and that you can do something about it. So I get emails all the time from people that say, in fact, probably every week, I would say Lisa and I get an email from somebody that says, hey, self-brain surgery is great and it's helping me process things and I feel better, but what if I have this? Or what if I've been through that? Or what if my kid has ADHD? Will it work then? Does it work for this? So I'm just telling you, this type of thought process, and Schwartz was so kind when he endorsed my book. He said, I don't think anybody's ever taken all this material and given it a practical application like you have in this new book. He really felt like I've added something to the conversation. So I'm just going to tell you, if Dr. Schwartz thinks that, then you should hear me when I say this. There is nothing that can happen in your brain that you can't process and learn to manage better by learning how to think about it differently and learning how to put your mind in control of it. Schwartz showed us that in brain lock, the most significantly difficult, recalcitrant, obsessive-compulsive folks, the people who had to take their oven apart and put it in their car and take it to the car wash and wash it because they didn't think their oven was clean enough. The people that had their marriages and lives and businesses come apart because they couldn't stop washing their hands every 5 minutes. These people who were so debilitated, Schwartz taught them a new way to think, and many of them got their lives back without medication. So Brain Lock is the book where he did that, where he dealt with obsessive compulsive disorder. The Mind and the Brain is a much more academic, very thick book that talks about the science and the research that he and other groups did that convinced him that mind and brain are not the same thing, and also showed it with neuroimaging, functional MRI, and modern brain imaging. This is the book. The Mind and the Brain is the book where the science meets the philosophical implications of materialism versus dualism, which is what I think most of us are, but believing that mind and brain are not the same thing. They're two different things that have influence and impact on each other. Mind and the Brain, very deep, detailed look, but really well written and incredibly inspiring. And you can see something happening to Schwartz over the course of his writing career. Brain Lock clearly is influenced by Buddhism and all that. Not a spiritual book, but he's very understanding that mindfulness is the key to this disorder. Mind and the Brain, you can see him evolving in some of the things he's saying and understanding that there's a lot more to this than just a physical thing. By the time you get to the third book, You Are Not Your Brain, which, by the way, that book's been out about 15 years, but he just re-released a new audiobook that he read himself, and it's tremendous. It's a great addition to the print book, and if you haven't read You Are Not Your Brain by Jeffrey Schwartz, I highly recommend it, because then he took the whole picture, not just the academic deep dive, but the clinical, like, here's how you do this thing. If you want to get your brain under the control of your mind, here's how you do it. And it starts by understanding that your mind and your brain are not the same thing. And in that book, he ends it in the epilogue by giving credit to what he finally figured out was the voice that's helpful inside the head. When the crazy voices, when the compelling voices, when the convicting and yelling and shaming and worrying voices are happening, that you got to wash your hands more, that you're never going to make it over this, or you're never going to recover from this. When those voices are loud, if you can get into that part of your brain where you can hear the true voice, he calls it the wise advocate. Okay, the wise advocate, I would call it the Holy Spirit or the great physician. It's the same thing. It's that voice where God is trying to communicate with us. And he does it, I think, in the right hemisphere of our brain. He does it in the realm of quantum physics, breaking into the connection between mind and matter that is true and it's real, and it will change your life if you finally understand that you are not just your brain. That book is really helpful. I'm so grateful for the time that we spent with Jeffrey, and even more so for his friendship and for the more than 50 years that he's been helping people understand that they are more than the neurons in between their ears. And friend, that is a hopeful message. You may say, why do we spend so much time talking about this stuff? Why don't you just give us a tool for anxiety or whatever? We're going to do that in the new book, okay? But if you don't fully understand and embrace and live out the idea that there's more to you than the activity of the cells in your body, then you'll never really break free from that feeling that if you're raised in the wrong family or go through the wrong things or didn't get the right genes, that you're just out of luck. Because that, my friend, is imprisoning, it's not empowering, and it won't set you free. What'll set you free is to understand this one simple truth that I try to tell you every time I have the privilege and honor of talking to you. You can't change your life until you change your mind. Dr. Jeffrey Schwartz helped us get that done today. Check out his books. Make sure that you subscribe to the podcast wherever you listen. Don't forget to sign up for my newsletter, drleewarren.substack.com. And the best news of all, my friend, is that you can start today. Thanks for listening. If you like the show, please subscribe wherever you listen, and be sure to follow me at Dr. Lee Warren on Instagram and YouTube. And to get the most out of the show, make sure to get my free weekly self-brain surgery prescriptions. Sign up at drleewarren.substack.com, and I'll send you the powerful thought biopsy worksheet for free. drleewarren.substack.com. Every Sunday since 2014, I've been bringing you my best prescriptions for how you can smash faith and neuroscience together to become healthier, feel better, and be happier starting today. I'm Dr. Lee Warren, reminding you to have a very self-brain surgery day.